to declare, and any sort of styles of yoga that I'm supporting are opinions of my own. And I just want to make sure everyone who is connected is just muting their microphone. So this talk, I'm going to try and sort of play both sides. I'm going to try and introduce yoga to those who know nothing about yoga, who just hear about it, perhaps in the media. And I'm also going to try later in the presentation to go over some scientific evidence, some meta-analyses, some reviews to actually show the evidence and support of yoga in the treatment of pain and other health conditions. So first, we're going to talk about the history of yoga, its various styles, the overall structure of what is a yoga class. We're going to talk about some general health benefits, some concepts that have evolved as yoga has become more popular, especially in the 70s, 80s, 90s. We're going to talk about the risks associated with yoga. And then depending on how much time I have and how nervously I speak, we have several articles to go through that I try to target basically the population of who you would see in the chronic pain clinic, mainly people with chronic low back pain, functional pain syndromes like fibromyalgia or chronic fatigue syndrome. Also look at its effect on mood and other specific conditions like osteoarthritis. Lastly, I'm going to talk about how to prescribe yoga and some of the pitfalls and some of my opinions and a few resources. So what is yoga? So yoga is, some would call it a mind-body practice. It's a physical, mental, sometimes spiritual practice or discipline, which originally originated in India, based on the calisthenics routines of the Indian Army. Some may say that yoga is thousands of years old, and this is true, but yoga as it is today is very, very much different than what it was thousands of years ago. It's primarily associated with Hinduism, but it can also be associated based from its meditation practices with certain other religions like Buddhism. And the three most important parts of yoga are what we call the asanas, or the yoga postures. These are the physical postures that you see in the pictures. Breathing techniques, also known as pranayama. Meditation, of course. And yoga was first brought to the Western world in the 19th century, and I'll talk to you a little bit about how that happened. And specifically in 1924, an Indian yoga scientist named Guni formed an ashram, and his yoga ashram trained many of the am I still muted here? Someone, okay. So many of Guni's students went on to become the fathers of yoga and spread yoga all around the world. So I want to talk about one figure in particular. He's a controversial figure. His name is Mr. Iyengar. He died at the age of 94, I believe, in 2014. And he was a very special man because in the 1950s, he ended up teaching yoga to a famous violinist who invited him back to Europe. And from that point on, he disseminated yoga throughout Europe and the Western world. And he was known for teaching many, many celebrities. And he is the father of Iyengar yoga, which is a very, very rigorous style that we'll talk about in a second. In 1966, Mr. Iyengar published this book called Light on Yoga. And basically, this was one of the first yoga tomes that actually sort of associated yoga with all these wonderful health benefits. Fortunately, Mr. Iyengar did not include many sources in this book. Made a ton of outlandish health claims about all the different benefits from each posture. But it was a really, really important book and was disseminated all around the world. So I want to make a quick note. It's when we talk about yoga, yoga is not one thing in particular. It is there are dozens, if not hundreds, of yoga styles, and I just wanted to name a few of them. Obviously, Kripalu is the one I'm most familiar with. This is based out of an ashram in the Berkshire Mountains in Massachusetts. It is a very sort of loving, accepting, very gentle yoga, and a very nice yoga for beginners. Ashtanga yoga, which may be familiar to some, is called an 8-point yoga, known for these 8 principles that it follows, and it's known as a very, very physical type of yoga. Bikram yoga is a very interesting style of yoga, basically spread by this man named Bikram Chaudhuri, and he trademarked a sequence of 26 poses. And this yoga is performed with the 40% humidity and at a temperature of 41 degrees Celsius, extremely, extremely hot. Vinyasa yoga, this is a type of yoga that is based on flows of postures, the progression of one posture to another, as opposed to holding individual postures. Moksha yoga on the bottom right, this is another type of hot yoga that is all around a lot of studios in Montreal. You may see it, it's now being rebranded as Modo yoga, but this is another type of hot yoga. And in the middle, you have Iyengar style. And one of the most important things that we're going to look at is that there's a huge lack of standardization in terms of yoga teacher training. So for example, my girlfriend went to Kripalu for a month, and she did an intensive yoga program that essentially trained her to become a yoga teacher over the course of a month. Whereas in the Iyengar style, you have to have been practicing for years before you even enter into their teacher training, and their teacher training lasts up to a year and has several standardized exams with independent examiners to make sure that the teacher is up to the task. I just want to make a quick note. Some of you in the media might be seeing Mr. Bikram Chaudhuri and Yoga Guru Predator. And on the right here, you know, I used to study Anusara Yoga. This is John Friend, the head of Anusara Yoga. He had a fall from grace when he was essentially accused of adultery, using his yoga teachers as drug mules, and robbing them of their pension benefits. Mr. Bikram has fled North America, and one of his lawyers has taken over his yoga empire here in North America because he has been accused of various sexual improprieties. So there seems to be a problem. I mean, while yoga is amazing and wonderful, it seems that its gurus are not immune to having their egos just massively inflated. So a typical class, if you were going to look at, if you were going to do yoga at a studio and pay for a class, a yoga class would run anywhere from 45 minutes up to 2 hours. Of course, there's much longer yoga retreats that you can go to, but a typical class is usually from 45 minutes to an hour and a half. It usually begins with a centering or opening commentary or instruction from one of the yoga instructors. This is to help bring the students in the class and center them around a theme. Following which there's several warm-up poses to get the body warm, followed by sun salutations, which we'll talk about in a second. or essentially a progression of poses to eventually reach what we call an apex pose. So depending on the class, you might have a different apex pose that you're working to, a different set of muscles that you warm up and cool down. Of course, after the apex pose, several cool down exercises and something called shavasana, or corpse pose, which is essentially where you lie on the ground, closing your eyes, motionless, focus on your breathing, and essentially just relax. Now, meditation can be used at the beginning of the class. I've even seen it in the middle of the class, but it's typically either at the beginning or at the end of the class, sometimes even after Shavasana. I just wanted to show everyone an example of what a sun salutation could be. Sun salutation typically is a progression of poses from the standing pose on the left here, Tadasana, to downward dog, which is this upside down V here, to cobra or upward dog, and then all the way back up to standing pose. So when you hear people talk about sun salutations, they're essentially doing a variation of this. There's no limit to the variation, and there are certain defined sun salutations, but it's not necessarily important. So after Iyengar, started popularizing yoga in the Western world, especially in the 70s and 80s, it became wildly popular and attracted a lot of marketing. And you see all these beautiful young women who are slender, and they make all these outrageous health claims. And unfortunately, this is kind of a theme in the yoga world, is that yoga is sort of presented as this panacea, this practice that can accomplish anything. And I just want to point out some interesting things, is that yoga is often touted as a way to increase your metabolism and as a form of cardiovascular fitness. Many yoga teachers will say that, yoga is all you need. However, in the 1930s, we actually developed a way to test aerobic fitness, and this is called the VO2 max, which literally means the volume of oxygen consumed in a given time. And I don't know if you guys have ever seen those exercise physiologists where they're actually measuring the oxygen consumption by these athletes. And this is directly related to cardiac output. So if you think of an aerobic exercise where you're pumping, your heart is pumping, and you're trying all your best to oxygenate your tissues, this is going to be an exercise that increases your VO2 max. Aerobic exercise will increase your cardiac volume, will increase your contractility, and increase your blood flow, and therefore your consumption of oxygen. So in Duke University in 1989, there was a 4-month study that essentially compared a normal aerobics routine with that of yoga. And despite the wild claims that yoga is all you need for cardiovascular fitness, the study actually showed that yoga showed no change in the VO2 max. Actually, there was a small decrease in VO2 max of the participants, but this was not statistically significant, as opposed to the regular aerobics routine that raised VO2 max by 12%. What was really interesting is that the researchers noted that while the yogis did not increase their VO2 max, many of them reported huge changes in attitude and outlook and mood, and they found that the improvements were really worth noting. So this actually spawned several more studies where many yoga teachers were adamant to prove that the yoga was all you needed for cardiovascular fitness. So further studies were actually done that included more vigorous cardiovascular stimulating exercises, such as the sun salutations. And they showed that there was some modest benefit for the yoga practice and cardiovascular fitness. But these studies actually didn't compare to a regular aerobics routine. So unfortunately, the jury is pretty decided on this one, that while if you're in a Bikram class doing lots of vigorous yoga, you might have some mild cardiovascular benefit, but overall, yoga is not going to improve your cardiovascular fitness. As per weight loss, in 2006, a study in India by Chaya found that regular yoga practice actually cut your basal metabolic rate by 13%. In the book that I read here, that's called The Science of Yoga, they talk about how the yogis actually don't lose weight through exercise, but rather through controlling their mind and desire. There's a quote that says that you might not think that yoga stops you from opening the fridge, but it does. Perhaps one of the mechanisms of why so many of these young women are so trim and fit is because they have more discipline that is fostered by their yoga practice. But it's not the yoga practice itself that is going to make you lose weight, despite all these outrageous claims. So I wanted to make a quick note on pranayama and just give you an example of some of the claims yoga teachers will make in Bikram or in other forms of yoga. There is a breathing exercise called Bhastrika, or hyperventilation. And this can be where you essentially breathe, inhale and exhale, sometimes up to 4 times a second. And they'll make outrageous claims that saying that all your cells in your body are filled with oxygen. And as many of the students will collapse hyperventilating, they'll say that your body isn't used to so much oxygen. Where actually, it has nothing to do with oxygen whatsoever. It's more to do with the regulation of your carbon dioxide. If you do what's called an ujjayi breath, where you slow your breathing and exhale against a tightened larynx to form a sound like, and you slow your breathing to considerably lower levels, you'll retain carbon dioxide. Your cerebral blood flow will increase because of the vasodilatation related to the amounts of carbon dioxide. If you hyperventilate or do Bhastrika, you're actually limiting your blood flow because you'll dump all your carbon dioxide and your cerebral blood flow will constrict. Now, thinking about hyperventilation, hypoventilation, one of the proposed benefits of yoga is that yoga is an actual way to regulate your stress response and get a better control of your autonomic nervous system. You can think of during a class when your muscles are pumping, you're balancing, you're contracting a lot of your muscles. This is going to drive your sympathetic nervous system. But then when you remain in the pose, you control your breath and focus, you can manage to decrease your sympathetic tone and increase your parasympathetic tone. And then this could, in the rest of your life, perhaps help in regulating your stress response. I wanted to show an extreme version of this. I don't know if anyone in the audience has heard of Mr. Wim Hof. He is otherwise known as the Iceman. And this man has broken many, many world records. He's climbed Mount Everest in his underwear, all with the power of pranayama or breathing exercises, because this gives him a strong command of his autonomic nervous system and seems to make him immune to cold, and to actually, through his breath, control his nervous system to generate heat to make him withstand these things. So before we get into the benefits of yoga, I want to talk about the risks. And unfortunately, like many great gurus will say that yoga is safe as mother's milk, it is not. There is a big culture of denial which isn't so much nowadays, but in the rise of yoga, many yoga teachers denied that injuries could even happen. It's interesting, in 1972, an English physician by the name of Dr. Russell issued a very, very strong warning in one, I forget which journal, but basically he ended up warning that certain yoga postures, given the hyperextension of the neck and the tortuous path of the vertebral arteries that pass through the cervical vertebrae, that yoga actually posed a significant risk for vertebral strokes. And following this warning, there have actually been a few documented cases of vertebral artery compromise due to extreme yoga postures. In 2002, the Consumer Product Safety Commission of the US did a wide-ranging survey of yoga teachers, and they anonymously reported many, many injuries, including dislocations, sprains, strains, peripheral nerve injuries, and even fractures. And what's really interesting is when all this media started coming out about the risks of yoga, many senior teachers started modifying the poses and actually coming up with a list of what they called X-rated poses. So I want to just give a few examples here. On the left, you'll see Mr. Iyengar actually in what's called a twisted headstand. And in the Light on Yoga, Mr. Iyengar specifically says that the entire weight of the body should rest on the person's head. Whereas now we understand that that's not a great idea. And many senior Iyengar teachers now recommend that the majority, if not all your weight during headstand is actually resting on your elbows and hands and only a slight amount of weight on your head. In the middle, the shoulder stand, which is essentially where your neck is in extreme flexion and you're resting on your head and shoulders with your feet jacked up in the air. This has been one of the poses that was associated with one of these vertebral artery compromises. So now when shoulder stand is practiced, it's generally recommended to actually use some mats to decrease the hyperflexion of the neck. The third pose that I wanted to show here is an X-rated pose is called the lotus pose, where you have your knees tucked over your thighs. And nowadays, this isn't a recommended pose because knees don't always bend that way. So getting enough about the wrist, let's talk about benefits of yoga. But before we go into the benefits and go into the research, I want to talk about a few problems that are very, very frustrating when we're trying to come up with evidence-based yoga. Essentially, there are so many styles, it's unclear which style for which condition is best. There are more meditative practices, there are more exercise-based practices. And in the literature, there are meta-analysis that include dozens of different styles of yoga. It's kind of like lumping apples and oranges together. Another problem is that yoga class, you can do a 15-minute home practice, you can do 6 hours a day at the yoga center. There's a huge degree of variation in terms of the duration and intensity of programs. Do you go to a group class with 20 other people, or do you hire a private yoga teacher who teaches you at home and does individual alignments? And unfortunately, as you'll see, there's yoga research is unfortunately plagued by low methodological quality of trials, many of which are not properly blinded or do not necessarily have appropriate controls. So I'm going to go into the evidence. It seems like we still got half an hour here. So I presented this patient, this study actually 4 years ago, but I feel it's a good place to start. So this is a critical review in 2012 by the American Pain Society by Osterman and al. The effects of yoga interventions on pain and pain-associated disability. Now, this study actually included 16 trials, 5 of which were randomized control with a single blinding, 7 without blinding, and of course 4 non-randomized. These included a wide range of pain conditions, including chronic low back pain, rheumatoid arthritis, headaches, migraines, and even labor pain. And essentially, they used visualized analog scale for pain rating and several questionnaires to assess pain-related disability. And they even had a sub-analysis on mood. So as you can see, this is the forest plot for yoga as an intervention for pain. I neglected to say that the controls in these studies are either another form of exercise, anti-inflammatories, or no treatment whatsoever, or waiting on a wait list. And as you can see, while there are still a few studies that cross 0 here, the majority of the studies favor yoga in respect to pain. The next forest plot is related to pain-related disability, and again, favoring yoga quite clearly for pain-related disability. Lastly, this is just the sub-analysis showing the effect on mood, and this study, this review seemed to suggest that yoga also had an effect on mood. So going right into the really nitty-gritty science research, I turned to the Cochrane Library and found a review in 2017, the yoga treatment for chronic non-specific low back pain. And I think this is particularly applicable in the chronic pain clinic. I think a lot of your patients meet this criteria. This study was this was a meta-analysis done in 2017, which included 12 trials. They defined chronic back pain as at least 3 months of back pain. The interventions varied between intensive programs lasting only 1 week up to 24 weeks of intervention. So again, I don't know if I have the statistical qualifications to be able to really tease out the problems, but I find it comparing apples and oranges when you think about doing 1 week of intensive yoga versus doing regular yoga for 2 years. Very, very different levels of intervention. So when compared to non-exercise controls, the Cochrane review concluded that there was low to moderate certainty to produce small to moderate improvements in pain at 4, 6, and 12 months. When compared to exercise controls, basically there was little to no difference in back-related function or pain at 3 to 6 months. Data afterwards was missing in this review. Moving on to functional pain syndromes. This is an article published in the Review of Psychiatry Journal in 2016. And this was a qualitative review that included 39 studies for a wide variety of pain conditions, including chronic headache, neck, back pain, fibromyalgia, pelvic pain, irritable bowel syndrome, chronic fatigue syndrome, and other somatoform pain disorders. And essentially, this author defined functional pain syndromes as a sort of absence of an organic cause causing these pain syndromes. So I'm just going to give everyone a chance to look at some of these tables. This is a good introduction to a yoga intervention in fibromyalgia. We see 8 studies. One of the problems is that aside from this second, the first 2 meta-analyses, Many of the studies have a small amount of participants. When they say hatha yoga, that simply means that the ancient form of yoga that was more based on sort of specific poses and also meditation as opposed to flows of poses. But of course, there are other styles of yoga, yoga of awareness, relaxing yoga, and basically showed good outcomes, improvement in pain syndrome symptoms, improvement of quality of life, decreased cortisol levels, and improvement in fibromyalgia symptoms. As you can see, I've skipped a table because we already talked about back pain, and the results are quite consistent with the Cochrane Review, perhaps even more convincing. But the table 3 shows the yoga intervention for headache. And of course, these showed positive improvements, moderate effect on pain and associated disability, pain scores. On table 4, just below here, we see a yoga intervention for neck pain. And one of the interesting parts about this qualitative review is that Iyengar yoga, which demonstrates to me that these are very well trained, dedicated teachers who have been taught for years how to teach yoga. These are all included. The majority of these studies are actually, the intervention was Iyengar yoga, and it actually shows quite promising results for the treatment of chronic neck pain. And there's also interesting that yoga was more effective than a home-based exercise program. I wanted to include a study from perhaps a less reputable journal, but a journal perhaps closer to the study of yoga. This is the International Journal of Yoga, studying the impact of a daily yoga program for women with fibromyalgia. This was a really intensive program where 5 days a week over a 6-week period, women were brought in as a group to do a 6-week yoga program. Of course, there was no controls, but this was a 15-participant qualitative study, and they interviewed the patients afterwards and organized their comments into 5 main themes. Essentially, they found that, that yoga helped them with their pain, improved their endurance, improved their confidence. In terms of practices affecting pain, what was really interesting is that the basic postures that did not require significant range of motion or flexibility seemed to have more of a positive effect on pain, whereas the more complex postures that required flexibility, or as one woman put it, where she had to do postures where she was kneeling, these actually worsened her pain. Most, if not all the women showed emotional changes, better mood, better concentration. They found that having a teacher was a practice motivator, and also being in a group actually helped motivate them and be accountable to coming to their yoga practice, in really participating in their self-care. And I think that this is kind of an interesting idea, is that while we want to, in science, boil down the intervention to its very, very core, the single person doing those poses, I think part of my yoga journey has shown me that there is actually quite a wonderful community effect when you end up practicing yoga with the same group of people on a regular basis. It's much easier to get yourself to that practice and to practice those self-care routines. I wanted to talk about yoga for depression, because I think this is really, really important in chronic pain. The proposed mechanisms for how yoga can help in the treatment of depression are that yoga is GABAergic. It increases levels of GABA. It also has been shown to increase levels of serotonin. And another proposed mechanism is that it decreases the pain stress cycle, or the sort of stress response related to pain, and is shown to decrease cortisol levels in other studies. So this meta-analysis was included 9 studies. This was published in 2013, and the yoga programs varied from 4 to 12 weeks. And essentially, this meta-analysis showed that the effects of yoga were comparable to pharmacologic treatment, group therapy, social support groups, and massage. And one of their conclusions was, yoga, all yoga requires is really the willingness of the participant. So this is a really interesting adjunct therapy. If you're considering prescribing antidepressants to a healthy young person with depression, maybe you should consider prescribing yoga as well. Now, it's a little confusing because they say in the subgroup analysis that they actually found more evidence for meditation-based yoga as opposed to exercise-based yoga. They found that the most statistically significant effects on depression were from meditation-based yoga. I wanted to show a forest plot from this study and particularly bring attention to yoga versus usual care. So many of these people were on a wait list or on medication like antidepressants, SSRIs. And the 3 studies that actually showed a positive effect here, one of them was an Iyengar yoga program. One of them was a laughter yoga program, which included stretching, laughter, and meditation. And one of them was an American version of yoga called Shavasana yoga, which is essentially where you're in corpse pose or lying flat on the ground doing breathing exercises and meditation. So I find it very difficult that these studies were lumped in together in the same meta-analysis, because to me, they're considerably different interventions. Zeroing in on sort of another study for reducing depression and anxiety. This was looking at an individualized yoga program where you had a senior teacher doing 4 individual 1-hour yoga sessions over a 6 weeks period. And essentially, this was the study design where basically they had 107 individuals and they randomized them to either a wait list or yoga intervention. And then eventually, all the participants ended up getting yoga intervention. They found that yoga had a statistically significant effect on depression scores, but not a statistically significant difference on anxiety, and that benefits were maintained 6 weeks after the yoga intervention was completed. The last study that I wanted to include here was just a systematic review and meta-analysis for osteoarthritis. Essentially, this is, I don't want to get into the details of the study, but 4 out of the 5 studies were in knee osteoarthritis. One of them was for hand osteoarthritis, and they downgrade the recommendation based on the methodologic quality of the studies, and essentially say that they have a weak recommendation to support yoga, mainly in knee osteoarthritis. And another study that I presented 4 years ago was in favor of Iyengar yoga for the treatment of knee osteoarthritis, which makes sense because it's a form of physical therapy, and physical therapy has been shown to help osteoarthritis. So in summary, we have, from the evidence I presented, there's weak to moderate support for yoga in the treatment of many different pain syndromes, chronic low back pain, different forms of arthritis, headaches, associated depression. I think it's interesting to note that meditation and breathing exercises have been shown to have an effect on mood, and maybe we should be thinking more about including those in our yoga-based interventions. There is a plethora of styles, lengths, and intensity of treatment that I find makes it difficult to study and compare studies. I think that yoga can have significant benefits, but it is not without risks. It is not safe as mother's milk. And if you're a regular practicing yogi, you'll realize that sometimes we bring these injuries upon ourselves, or that we're actually pressured in a group setting to perform and actually do something that we probably shouldn't do. I've also talked about how yoga has been demonstrated as not useful for cardiovascular fitness, not useful for weight loss. And my perspective on all this is that yoga, for me, it's a practice that I have developed and that I have carried with me throughout the years. I don't think that yoga is really a limited exercise-based intervention. I feel that yoga actually is a practice that develops initially physical discipline as we focus on the asanas or the postures, and then it transforms into a form of mental discipline where we're actually learning about ourselves, increasing our self-awareness, and actually maybe engaging in a better self-care routine. Yoga is not for everyone, and certainly the cheap yoga class may not be appropriate for a person with chronic problems and with significant health problems. There's a real lack of standardization of teachers and therapists. Just because you're a registered yoga therapist doesn't really mean anything. It means that you've completed a teacher training and that you've paid a certain fee to the registration body. The association with religion and spirituality may be a barrier for some. When people are chanting or oming at the beginning of a class, it may send new practitioners out the door. So my recommendations on how to prescribe yoga is essentially to encourage the student or the patient to find a studio, teacher, or home practice that works for them. I would consider that it's better you get what you pay for. Sort of better, more sort of expensive studios actually attract more senior teachers. And I have more faith in Iyengar teachers given the rigors of their teacher training. I think that yoga should be a 15 minutes minimum, and longer practices can be far more profound. I would actually think about, if you're thinking about advising someone to try yoga, doing a weekend retreat might just break the ice for them. Also, I don't recommend hot yoga for beginners. There's often a lack of alignment cues, and the heat can provide an additional distraction from proper form, and I don't recommend it for beginners. You want to integrate the yoga practice into the patient's self-care and exercise routine. I think that pranayama and meditation should not be ignored. They should be encouraged. You want to warn patients of the risks. I don't think there's any benefit in putting your leg behind your head. I don't think there are benefits to extreme positions. I think there's a limited benefit and there's a high potential for injury. And then you want to follow up with your patients. You want to ask them what are about the lessons that they learned on and off the mat. Like, for example, one of the things that I've learned in my yoga practice is that I don't need people to push me. If I'm in a group situation, sometimes I'll do something sort of in the spirit of the moment when really I should be keeping cool and doing something much more basic. I just wanted to provide 3 resources. This is the end of my presentation. There's a really good YouTube video, 30 minutes, back care exercises that you can prescribe to your patients. It's free. Glow.com, while we're all stuck at home, it's a subscription service. It has pre-recorded yoga classes, and there are 2 yoga teachers that I like there, Elena Brower and Sean Korn, and of course the Kripalu Yoga Center. It's a great place to go for a few days and really rejuvenate, and treats a wide variety of conditions. Thank you so much for the opportunity to present. Does anyone have any questions?